A calf strain can take down any athlete instantly. So in this video, I want to give you the tips that we give to patients in our sports injury clinics so that you can bulletproof your calf complex and prevent these injuries from occurring. We're going to talk why the calf's susceptible to injury, what constitutes the calf complex. We're going to talk about flexibility, strength, balance and self-maintenance so you can make sure that you keep out there doing the things you love, free from calf pain. Now, if you're new to the channel, my name's John. I'm a sports injury therapist and I want to help you to understand your body better, get rid of any pain and weaknesses so you can strive forward and hit those health and well-being goals. And as I've mentioned, calf strains can stop you doing that. So firstly, well, why is the calf complex so susceptible to these injuries? Well, it makes perfect sense. It's our area of muscle closest to the ground. So every step we take, every run we make, every jump we land, we're creating that impact force that has to be absorbed by that calf complex, and the body ultimately is good at doing that. At the ankle joint, we have the movements available to us of dorsiflexion and plantar flexion, so the calf has to go through a shortening and lengthening process to allow us to walk, jump and run. So unfortunately, sometimes we get a breakdown in this mechanics and that can lead to a calf strain. Now, what is the calf? Well, the calf complex for me is made up of three key players, three key muscles: the gastrocnemius, the soleus, and also our tibialis posterior. And we're going to talk about all three of those in this video. While I dive into my top tips now and the things that you need to be addressing, checking and working on at home to make sure you avoid these injuries. Now, the first thing is around our flexibility at the ankle joint. We need to make sure we're flexible because the length of or range of motion that we have available to us at the calf directly relates to how much movement we have at our ankle. So we call this dorsiflexion, and this is the ability to drive our knee or our shin, if you like, over the toe whilst keeping the heel flat on the floor. So how do we check this? Well, in clinic, one of our clinical tests is what we call a knee to wall test. But the good thing is this is a nice, easy test that you can do at home. Now, what you want to do for this test is that you want to take your toes about a fist distance away from a skirting board. So place your fist up against a skirting board or flat onto the wall and place the toe behind that. The rest of your body can either be standing, or it works really nicely, this test, if you're kneeling on the floor. And what you want to do is, with the toe that distance away from the wall or skirting board, you want to see if you have the ability to drive the knee over the top of the toes so that you can reach the wall with the knee without lifting your heel up. If you can do that from a fist distance, we would call that normal range. Now, a fist different distance, roughly speaking, we are looking for 10 centimeters of range, and your fist is roughly about 10 centimeters. You can measure out 10 centimeters if you can be more specific, but I always go with a fist distance to give us a good guide. Don't forget to compare both sides. It might be that one side has full amount of dorsiflexion and the other side has much less. What does that mean? Well, if we've got much less, and we have to lift that heel up a little bit in order to get to the wall, we know we're tighter on that side. So we need to work on improving the flexibility. How do we do that? Well, that's when we have our three key stretches, which I'm going to talk about now. Now, the good thing about stretching is you can be doing this every day. You can repeat stretches multiple times a day as we try to improve that flexibility. Firstly, we've got our gastrocnemius. And as you can see here, what we want to do is make sure that, firstly, a few key points: the heels should be super glued to the floor. We don't want to lift those heels, particularly that back heel. We want to make sure the toes are in a nice straight line. We want to make sure that the back leg is straight while we drive that front knee over the toe. What we should be seeing or feeling, is that back leg calf area being stretched out. We're actually stretching out our gastrocnemius here. And as with all stretches, we want to be holding this for 30 seconds. The next stretch, we can just slightly modify to hit a different muscle in that calf complex. This muscle is called the soleus. All we do here is bring the feet a tiny bit closer together, and this time we bend the back leg as we drive that front leg knee over the toe. Again, you should be feeling this in a similar area, but perhaps slightly deeper and lower. That's when we know we're hitting that soleus muscle, the second muscle of the calf complex. And finally, one that's often missed for me is to try and hit our tibialis posterior muscle. So tibialis, the tibia is our big thick leg bone, the shin bone if you like, and posterior means behind. So this is the muscle that sits directly behind our shin. How do we get this? Well, we take that soleus stretch and all we do is we kick that back heel out. So imagine that heel being turned away from the midline. And you should start to feel that in a similar area, but perhaps slightly deeper. So by working this calf complex and hitting each stretch for 30 seconds, so 1.5 minutes on each side, a good 3-minute program in order to make sure you're as flexible as possible at those ankles. But we don't want to stop there. We don't just want to have this flexibility. The calves need to have the ability to absorb force and to absorb this force going through the movements of plantar flexion and dorsiflexion. So how can we work that at home? Well, the way I like to do that is with an exercise like a heel drop off a stair. All we're looking to do here is place the ball of our foot, and we're in a single leg here, the ball of the foot onto the stair, and then what we're looking to do is drive the heel beneath the level of the stair and then push up. Now, the bit going down, we want to be nice and slow as we load up that tension, or what we call an eccentric contraction, and then we contract up a little bit quicker. So a concentric contraction through that muscle. We can repeat this exercise 12 times, looking to do 3 sets. And remember, we want to be doing this on both sides. Compare, do you find that you fatigue on one side compared to the other? That shows us we're a little bit weaker. But this is a way of making the muscle nice and strong throughout its range. What next in terms of tips? Well, the next thing I like to talk about is a bit of self-care. So what we want to be doing here is making sure that we're utilizing any at-home rehab tools that you might have. This might be things like balls, this might be things like massage guns as I grab my various bits of equipment here. But we're looking at things like using trigger balls, which these are 2 of my favorite bits of self-massage work. Both work great for calves. Massage guns in particular, really handy. Have it next to a chair or sofa at home, watching the TV, grab that massage gun. In particular, you'll know, regular viewers, that I like this bullet-shaped head on the massage guns and really trying to find those sore points in the calf. Work into it nice and slowly. We can don't even have to have it on the hardest setting. What we're looking to do is relax that tissue. So bits of self-care can be really helpful. Along that line, we also want to make sure that we've got the right footwear for our task, which makes perfect sense. If we're talking about this impact force from the ground, we need to make sure that the footwear is appropriate. So if you are somebody who's out there running, pounding the streets, going for long miles, we need to make sure that we've got the appropriate footwear, and I would always recommend that that is assessed so that you have the right amount of arch support. If you're somebody who does a sport where perhaps you have to wear footwear suitable for the task, but that might not provide the best support. So for example, a football boot, or a dancer, or a gymnast in particular, where perhaps you can't wear any footwear. But what we need to look to do here is make sure that we're doing the best things that we can do. So in the sense of a footballer, if you're someone who's wearing a boot, something like a heel raise can be really helpful. Or even if you're just somebody who's in the gym working out with trainers, what we want to do here is to make sure that we could use something like a heel raise to take away some of that shock. By heel raise, I just mean the gel cups that be inserted into a shoe should be nice and cheap to purchase, easy to purchase, and actually something that you don't even notice in your shoes. So that's something that I would recommend if you are looking to either prevent, or particularly if you're somebody who suffers with calf tightness. Now, the final tip that I always like to discuss, because it's sort of indirectly a cause of calf strain, is making sure that we've got good balance, or to be specific or anatomical or scientific, whatever word you want to attribute to it, we want to make sure that we've got good proprioception. Why is this important for the calf complex? Well, really our balance and proprioception, a big part to play is our ligament structures. But the problem that I often find with patients is if they're not doing their job, then the nearest areas will look to compensate to help out. Our body is great at allowing us to achieve a task, but perhaps it forms compensation patterns in order to do that. So I find the calf to be a real victim of this. If the ankle ligaments or the ankle proprioception or balance isn't strong enough, then what we find is that the calf dives in to help out. And unfortunately, by making that then overused or overworked, it leaves us more susceptible to these calf strains. So how can you test your balance? Well, simply standing on one leg and looking to compare your balance left to right. We can make this single leg balance harder by closing our eyes. all of a sudden you'll feel the ankle ligaments start to shake. And again, is there a difference to left or right? Can you do this? Are you unable to do this? If you're unable to maintain your balance, we know that we've got a weakness or a poor recruitment pattern happening there. And this is a simple exercise that could be adopted at home. I always recommend people when cleaning their teeth do it standing on one leg. Great way to improve that balance, a task that we're doing a couple of times a day. So not only are we improving our dental care, but we're also making our ankles stronger. There's also something like a star or a Y balance, or these tests that are very easy to replicate at home that we often use in clinic to check out your balance. So here you see what we're looking to do is keep the body weight on the leg that remains in the middle while the other leg goes forward to touch as far as they can in the different directions. Now, what you might find is that one leg is much weaker than the other. Again, a classic example that we want to work on that balance, because this will be removing the chances of us overusing that calf muscle. I hope that's been helpful. This has been a real whistle-stop tour in how to prevent calf muscle strains. But what I want to do is reiterate those few key points. We want to make sure that we're flexible in the area. We want to make sure that we're strong in the area. We want to make sure that we're providing self-care for that area. And finally, we want to indirectly make sure that the balance is good, because that's going to give your calves a break. Now, I could talk in much more detail. If you're finding that those strengthening exercises are too easy, what we could look to do is to progress these to dynamic exercises like pogos or plyometric work. But I think that's for another video. But if you have any questions or comments or anything you'd like to add, please feel free to drop those below. And don't forget to subscribe, hit that bell notification so I can keep you updated as soon as I drop the next one.